This morning's Health Watch, some surprising news about strokes, the third leading cause of death in this country. Our Dr. Jennifer Ashton is here with details on some new research. Good morning, Jen.
Good morning, Maggie.
So this new research discovered some bad news, which is that stroke patients are getting younger.
That's right. That is the bad news. We normally consider stroke to affect people in their older age group. However, we know that with things like obesity, the risk factors that put people at risk for stroke, obesity, high blood pressure, diabetes, cholesterol, it's going up. And in fact, to look at the numbers, in 1993, about 4.5% of the people who had strokes were in the 20 to 45-year-old age group. That number has gone up to 7.3% as early as 2005. So it's a trend we need to watch.
So primarily it's because we generally are unhealthier beginning sooner.
Well, that's one of the theories. The other theory is that we're getting better at detecting strokes with imaging techniques. So it's a combination of things, but it's an important trend.
All right. The next fact is good. Marital bliss actually may help reduce your stroke risk.
That's right. If you're happily married, they found that single men were at much higher risk of suffering a stroke than men who were married. And if you're happily married, that's more protective than being unhappily married. Again, the thinking here is that your spouse might have beneficial impact on your lifestyle, on having you take medication, and if you are having a stroke, getting early treatment.
And there's good news for coffee drinkers as well.
Good news for coffee drinkers. If you like your Java, whether it's caffeinated or decaffeinated, people who drank coffee had a much lower risk of having a stroke. In fact, they found that 29% reduction in the risk. Not clear why. It's an associative finding, but again, you don't want to overdo it, but coffee in moderation seems to have a protective effect.
Are there any other ways that are proven to reduce your stroke risk?
Well, again, the things that are good for your heart are also good for your brain. Exercise, good diet, maintaining good control of cholesterol, blood pressure. You want to be healthy for your heart and your brain.
All right, Dr. Jennifer Ashton, as always, thank you so much.